Good morning everyone, welcome to Center of Balance Life. Can you guys hear me or see me clearly? Please type 1. My name is Kenny, the acupuncturist and the Chinese medicine practitioner from Center of Balance. Today I'm going to talk to you about wrist arthritis. Do you or do you know anyone who suffer from this condition? If you do, please type 2. Please help us out by liking and sharing this video for those who might benefit from our daily free-to-all acupressure self-treatment. Do you know wrist is a complex joint? It is actually made out of multiple small joints, and when healthy, the bone glide easily over each other during movement and protected by smooth cartilage that coats the joint's surface. Arthritis involves inflammation of one or more than one joints that damage the cartilage. As the condition progresses, there is a gradual loss of cartilage. Without a smooth joint surface, the bone can rub against each other, leading to joint damage along with other typical signs of pain, stiffness, swelling, or weakness. And all these can make it quite difficult for you to do your everyday activities. Although there are hundreds of kinds of arthritis, most wrist pain is caused by osteoarthritis, rheumatoid arthritis, or post-traumatic arthritis. 1. Osteoarthritis can develop due to normal wear and tear in the wrist, particularly in people who have a family history of arthritis. This chronic condition can be caused by the breakdown of the cartilage, which cushion the end of the bone where they meet to form the joints. This breakdown can cause the bone to rub against each other, which will lead to the stiffness, weakness, pain, and loss of joint movement. Rheumatoid arthritis is the second one, which is an autoimmune disease. This means that the body immune system will attack its own tissue. This chronic condition affects multiple joints throughout the body. It can often start in a small area of the joint, such as those found in the hand and wrist, and usually affect the same joint on both sides of the body. And aside from the symptoms that I mentioned earlier, it may also lead to joint deformities, thus difficult to use, or even serious the loss of functions. The third one is the post-traumatic arthritis that can develop over many years from the initial injury, a direct injury to the cartilage or a delayed wearing of the cartilage due to change in the way of the bone that move together, such as after a ligament tear or broken wrist bone. Well, not all patients with arthritis will experience symptoms. When they do occur, the severities can vary greatly from patient to patient. And for some patients, if the symptoms are not constant but may come and go depending on the level of activities and other lifestyle factors. With proper treatment, many are able to manage the symptoms and stay active. Let's see how well your body responds, or how well you respond to the acupressure points that I'm about to demonstrate. As usual, do you have any of these 3 tools? Your knuckle, or some small rounded tool. A third one, a massage device. And I would encourage you to get either number 2 or number 3, a massage device, because it's involving our joint here, and your wrist, your pain might even get further up. Okay, any of these three can be used to locate sensitive points and apply pressure for 15 to 30 seconds, and then you move on to the next point, and then you repeat the same thing for 3 times. You can even do it 3 to 5 times throughout the day. But if it's too painful, I would advise you to do the acupressure every hour. Right, where do we go from when it's wrist pain? Of course, we go to our wrist, but on the opposite side of your pain. So if your pain is on the right side, we go to the left side. Okay, so if your pain is on this side, which is my left, okay, and you can go to your right side of your wrist and find the most sensitive points. You can start from, again, I like to start from the pinky end. You start palpating for the most sensitive points around here. Okay, if your pain on the left side is around this area, just under the one of the bone, the pisiform, then you go to your right side, same area, around this area, you palpate and find the most sensitive points. Okay, and then you hold for 15 to 30 seconds, and then you continue, you move on to the next point. Of course, if your pain is on the left side and is at the back of it, right around this area, again, we can start from the wrist on the pinky side and walk along. Okay, if your pain is on the left, then you move on to your right side, back of your hand here, and you start palpating again. You start from your wrist and you work your way around. Okay, again, why not on my left side? Well, then we like to use the distal side to treat your painful side, because when you're doing it, you can also try and exercise at the same time. Yes, you can do it on the left side, but you don't have to do it here. If your pain's here, you can do it on the opposite side. Again, you palpate for the most sensitive points. Like I mentioned earlier, your pain might not just be on the wrist, okay? Might be further down or further up too, might radiate. So what happened? Again, on your left side, you move on to your right side. This time, you use 3 of your fingers and you locate within this area. You can palpate and find the most sensitive points. Of course, on the palm side, you can do it on the dorsal side too, which is the back. Okay, again, 3 fingers within this area, find the most sensitive points. Okay, if it's going down, of course you find down. If it's going up, you can continue to do them at least 3 fingers, 2 to 3 fingers. Okay, so within this area, you can palpate too. Of course, on the palm side, on the dorsal side too. Right, a second area that we can palpate and to find a painful point on your wrist, you can go to your ankle. Okay, around the highest point of your ankle, so you can try and palpate. This is on the lateral side, which is on the outer side of your ankle. If your pain's on the left side, you go into your right ankle first. Okay, so you can start palpating, trying to find the most sensitive points. You can palpate around, find the most sensitive points. If you find one here, okay, you hold for 15 to 30 seconds. Okay, of course, you can also do the inside of your ankle. Okay, again, ankle will be a starting point. You try and locate around the ankle. Okay, you find the most sensitive points and you apply pressure for 15 to 30 seconds. You repeat 3 times. Okay, of course, left, right, left, right. So please go and experience around, and feel free to let us know which one or which side work best for you, whether it's on the opposite side of your wrist or on your ankle. Don't worry, if these tips not giving you much relief, we care about you, we're here for you, and we love to help you. So feel free to just call us and email us info@balancetcm.co.nz to book an appointment. We have 3 clinics in 3 different places: Hamilton, Raglan, and Auckland. My name is Kenny. That's all from me today. Thank you for joining us, and if you enjoyed this video, please give us a thumbs up, like and share. Look forward to seeing you guys again. Stay awesome and stay positive.